Okay. I am here today with Dr. Donald Trump at Inova Schar Cancer Center. And Dr. Trump, I have known since we collaborated in 2007 with the establishment of our very first scientist consensus on what vitamin D ought to be measuring. And in this case, it was serum levels. Today, I, Carole Baggerly, who am Director of Grassroots Health, have the privilege of meeting with him, and we're going to talk about breast cancer. Dr. Trump, tell us a little bit about the effect of vitamin D and breast cancer. Why is it important, or what have your studies shown?
Well, as you well know, Carole, and it is a pleasure to see you again and refresh our long-standing collaboration. There are substantial numbers of studies that point out that vitamin D is important in controlling the growth of cancer cells, the interaction between the microenvironment and cancer cells, the invasiveness of cancer cells, and many epidemiologic studies indicating that vitamin D levels are important in the genesis of cancer. Some of the work that you have been instrumental in pulling together adds to that study, or that set of facts, that their data clearly suggests that individuals, in this case women with higher vitamin D levels measured in the blood, have a measurably lower risk of getting breast cancer. That's consistent with many other studies, and the recent work that you've brought together expands those studies. So I think we know vitamin D is a very safe compound, that it can be given substantially higher than the usual recommended doses, with great safety, and vitamin D supplementation appears to reduce the risk of many illnesses, and in our context, specifically breast cancer.
Dr. Trump, as a result of actually much work that you have done and others, but a paper that we're just getting ready to publish, which also has, I'm delighted to say, your name on it, about the reduction in the risk of breast cancer, we are starting, Grassroots Health is starting a Prevent Breast Cancer Now project. And you've taken a little bit of a look at this, and it's aimed at being a community project to reach out to members of a community to make sure their vitamin D levels are at least in the range of 40 to 60 nanograms per milliliter, and to track their health outcomes and see indeed if in this community that we can help everybody lower their breast cancer risk. Could you comment on that, please?
I'd be happy to. As we mentioned, there are many studies that suggest that breast cancer risk is reduced as your vitamin D level is increased. The paper that you've led the organization of extends that investigation to look at higher than the usual levels of vitamin D achieved in prior studies. And this study shows even more striking impact of higher vitamin D levels. So that, combined with the clear safety of vitamin D, I think persuades me that working with you to try to develop this project to raise community awareness, to track outcomes, and prevent, we hope, not only breast cancer, but likely other diseases, is something I'm very interested in talking through and getting activated.
Guess what, folks? We are going to keep him involved. Thank you so much, Dr. Trump. I really appreciate your time. Thank you.